Assalamu alaikum everyone. This is Dr. Hanan. I hope you are all doing well. بتمنى إنه كلكم تكونوا بصحة وعافية وسلامة. This is our third lecture of the orthodontics course, and today we're going to begin talking about craniofacial growth. This lecture is part one of craniofacial growth because it's a very big topic. This is the lecture outline. Today we're going to talk about the importance of understanding growth, some phases of the development of the fetus inside the womb, how craniofacial development starts. It has several phases: the germ cell layer and neurulation, the pharyngeal arches formation, and the facial development. We're going to also talk about some craniofacial syndromes because they are related to how growth is happening inside the womb, okay, like cleft lip and cleft palate. So why is it important for us as dentists and particularly as orthodontists to understand growth and development? It is important because most often we are treating children that are still growing. Okay, we have to understand how growth starts and when does it end, the rate of it, the normality, what is normal, what is abnormal. So we can choose the optimum timing of our treatment because this growth is going to affect malocclusion, it's going to affect the jaws of the face. It also matters because when we understand how growth happens, we can understand the predictors for success in our treatment and any potential pitfalls. We can anticipate the stability of our finished results. Okay, we can also choose the timing of certain treatments. When do we do surgery, orthognathic surgery with orthodontics, when not? There are also modalities of treatment where we as orthodontists can modify growth favorably to enhance or let's say decrease a certain malocclusion. Okay, we also need to understand the anatomical and developmental defects in craniofacial syndromes because these patients most times need dental care and orthodontic care. Okay, so some basic definitions is to differentiate between growth and development. Growth usually refers to an increase in the size or number. It is largely an anatomic phenomenon. However, development يعني زيادة التطور بالإشي. Okay, it refers to the increase in complexity of a structure, an increase in its specialization. Okay, so it is mostly not about size or number. It is mostly about physiology and behavior of a certain structure. So, intrauterine life inside the womb is divided, generally speaking, into three phases of development. The first phase is in the first 2 weeks. We call it the zygotic phase. After the first 2 weeks, between 2 and 8 weeks, it's called the embryonic phase. وهاي هي أكتر فترة إحنا رح نركز عليها اليوم فيها most of the craniofacial development. Okay, and then we talk about the phase from 8 weeks until birth, and it is called the fetal phase. Fetal phase, sorry. This is for you mostly to understand what is going on. Okay, so the zygotic phase, it's the shortest stage of the fetal development. It begins at conception when the sperm fertilizes the egg, and we all know then it becomes called a zygote. Okay, the zygote will begin its journey from the fallopian tube to the uterus. Okay, it will divide quickly during this time. It will give rise to two structures. One will form the embryo later on, and one will form the placenta. Okay, and the cell division will be at a rapid pace until the zygote turns into something we called a blastocyte. The blastocyte arrives at the uterus and implants into the uterine lining. The second phase اللي احنا بنحكي عنها مهمة كتير بالنسبة لنا هي لما البلاستوسايت يبلش ياخد distinct human characteristics, and now we call it an embryo. So this is why it's called the embryonic phase. Okay, we are talking about an embryo now. Cells during this phase differentiate and organize into different tissues and organ systems under tight genetic control. Structures like the neural tube, which becomes the central nervous system later on, the head, eyes, mouth, and limbs, as well as the heart, okay, form during this period. فإحنا we can hear the pulse of the baby or the embryo between 5 and 6 weeks. Okay, by the end of the 8th week, most of the embryo's organs and systems take shape. After the 8th week, now the embryo, we call it a fetus officially, and the fetus major organs and body systems continue to grow during this period. This period is mostly about growth in weight and length. Of course, there's still some differentiation and specialization. However, it is less than what happened during the embryonic phase. Okay, so إحنا أكتر إشي بهمنا شو ال craniofacial development, the development of the cranium and the face. هاي بتصير during the embryonic phase mostly إذا بتطلعوا على الأيام from day 17 يعني بعد ال second week up to day 50 or 55 اللي هي up to the 8th week. Okay? So the first stage of craniofacial development is the germ layer formation. Okay, so you have to know that early in the development, the embryo is actually a flat, disc-shaped organism made up of 3 layers of pluripotent or multipotent cells called the germ layer cells. في عنا an inner layer that's called the endoderm, the middle layer that's called the mesoderm, and the external or outer layer that is called the ectoderm. This is a table for you not to memorize, but just to take a general look at it, okay? And check what are the derivatives of each of these layers. So the ectoderm is a very important layer. It's gonna give us, for us as dentists, it's important because it's gonna give us the tooth enamel. It's also gonna give us the dentine and the cementum, okay? So the second stage is called the neural tube formation or neurulation. Okay? So خلينا نحكي هون ال neural plate منطقة من ال germ cell layer, the ectodermal part actually of it. It's gonna fold upon itself as you see in the pictures and these electron microscope slides and form something that is called the neural tube. From head to toe, this neural tube goes inside the embryo and it's gonna later on form the brain and the spinal cord. Now, some of the cells do not directly contribute to the tube but become detached from it and are remaining here in the area near the crest of the neural tube. These are called neural crest cells. Now, these cells are stem cells that are multipotent and will later on migrate to form different structures of the head and neck. So these neural crest cells will give rise to cartilage and bone of the skull. They will give rise to cartilage of the pharyngeal arches اللي هلا رح نحكي عنهم كمان شوي, of bones of the facial skeleton, and to the odontoblasts, which are the tooth-forming cells. So as we said, these neural crest cells are very important. Most of the structures of the face are derived from them. So of course, if there was any problem during this stage, it's going to cause facial deformities later on. Okay. This also happens because of drug-induced impairment. يعني women that take drugs during this period, which might affect the neural crest migration, it's going to cause facial deformities later on. And this was reported with a very famous drug إذا بتعرفوا اللي بتاخد عشان الأكني, which is called Accutane. Since these cells migrate from the central region of the embryo to the sides and contribute to these facial bones, okay, the cells that have the longest path of migration are gonna be more خلينا نحكي susceptible to problems. So we can see that these on the lateral and lower areas of the face are most affected, whereas those that are going to the central face tend to complete their migratory movement without problems. Altered neural crest development has been implicated in syndromes as Treacher-Collins syndrome and hemifacial microsomia. So as you can see, this is the Treacher-Collins syndrome. Okay, there is a generalized lack of mesenchymal tissues in the lateral parts of the face. Okay, note the underdevelopment of the lateral orbit of the zygoma and sometimes even the ear. While in hemifacial microsomia, from the name, it is hemifacial, it affects half of the face. Okay, and it is characterized also by lack of tissue on the affected side. Typically, the external ear is deformed, the ramus of the mandible and the associated muscles and fascia are deficient or missing. Now, by the 4th week, the embryo looks like this. It folds upon itself in the retrocaudal axis and in the lateral axis. As you can see, this is the neural tube from cephaloregion to the caudal region or from head to tail. Okay, this is a cross section and you can see the neural tube here. And the neural tube is now segmented or divided into a forebrain, a midbrain, and a hindbrain. So this is a close-up image of the embryo, the forebrain, midbrain, hindbrain of the neural tube, and the formation of 6 pharyngeal arches on the ventral side. Now these pharyngeal arches are called pharyngeal because they are derived from the primitive pharynx. Okay, there is another name for them which is the brinchial arches. There are 6 of them, and if we take a cross section, you can see the pair of each pharyngeal arch. Each pharyngeal arch is covered externally by the ectoderm. From the inside, it is made up of a mesoderm, and from the inside, from this side, it is lined by an endoderm layer. As development proceeds, this central core, okay, is usually infiltrated by the neural crest cells. زي ما حكينا that they migrate from near the neural tube in the middle, okay. Each mesenchyme or middle portion of the arch is made up of cartilage, of muscles, of blood supply, and a nerve. Each arch from the outside is separated by the second one by this dipping that we call a cleft. بينما from the inside, this dipping is called a pouch. Now each pharyngeal arch gives rise to structures in the head and neck. Okay, the most important one for us is the first pharyngeal arch. It goes on to form the maxilla, mandible, the dentition, and the associated muscles and nerves. It also includes some of the bones of the middle ear and the external ear. You can read about the rest, okay? What is important to know is that the fifth pharyngeal arch is actually an arch that disintegrates and does not contribute towards any permanent structures in the human. Now, towards the end of the 4th week, the cephaloregion of the embryo will start to form distinct swellings or processes around an opening. It is the primitive mouth opening. It's called a stomodium at this stage, and later on it will be the opening of the mouth. The first process or swelling is this big one. It's called the frontonasal process. And then the first pharyngeal arch is going to give us the maxillary processes. 2 processes, each one are on the lateral side of this opening, and the mandibular 2 processes اللي هم on the lower border of the opening. So the 2 mandibular processes are going to join together in the midline early on. بينما the maxillary processes will continue to grow forward and towards the midline, and they will join much later than the mandibular ones. The frontonasal process هيصير في عنا on the sides here 2 thickenings of the ectodermal cells. Okay, هدول بنسميهم the nasal placodes. Okay, around the nasal placodes cells will proliferate ليعملوا لنا زي swelling شكله زي الهورسشو. هذا الهورسشو من جوا هاي medial aspect of it or the medial aspect is called the medial nasal process. بينما from the outside is called the lateral nasal process, and in the middle the nasal pit is going to form. As you can see here, we have the medial nasal process, the lateral nasal process. These were derived from the frontonasal process. Okay, you can see the 2 maxillary processes are still on the side. You can see the stomodium here, and you can see that the 2 mandibular processes have already joined at this stage. The medial nasal processes are going to grow towards each other and then merge. Okay, and they will develop something called the intermaxillary process. From its name, intermaxillary, then we know and understand it's going to be in between the 2 maxillary processes. The maxillary processes will continue to grow towards the midline, and then they will merge with the intermaxillary process from each side to form the philtrum and the upper lip. So the philtrum is made of the 2 medial nasal processes that formed into the intermaxillary process, and then the upper lip is gonna complete its formation by the fusion of this process with these ones. The maxillary and mandibular processes on the side are going to merge and fuse to form the cheeks, and wherever they close, they're going to determine the width of the mouth, okay? So here's another illustration that is color-coded for you to understand. The medial nasal process contributes to the central part of the nose, okay, and the philtrum of the lip. The lateral nasal process forms the outer parts of the nose, and the maxillary process forms the bulk of the upper lip. Fusion between the maxillary and mandibular processes establishes the width of the mouth opening. Going to the palate, the formation of the palate or the development of the palate takes time around the same time frame when the face is developing, and it starts around week 6 and ends by the 10th week. Embryologically speaking, the palate is divided into two parts, the primary palate, the anterior region here, and the secondary palate, and this is depending on where these parts are derived from. The primary palate is derived from the medial nasal process. It gives rise to the 4 maxillary incisor teeth, their alveolus, and the triangular region of the hard palate اللي هي up to the incisive foramen. بينما the secondary palate اللي هو باقي البالت without this anterior region is derived from the 2 palatal processes of the maxillary processes. So the medial nasal processes give us the primary palate, بينما the maxillary processes give us the secondary palate. So the secondary palate is made up of 2 palatine shells نازلين من الماxillary processes. هدول palatine shells, this is a cross section by the way, they are vertical at first, okay, and this is the tongue. And then they will continue to grow and develop, and then eventually they will elevate, as you can see, and grow towards each other and then meet in the middle. Here, هون بيكونوا نازلين, then they will grow and lift up and then meet in the middle and fuse completely, and this will give us the full palate. They will fuse also with the primary palate from the front. So by that fusion, we have separated the nasal cavity above them from the oral cavity underneath them. So as we can expect that these processes, their fusion is very important to the formation of the structures in the face. If there is any problem with the fusion of these processes, we're going to have failure of fusion, and that will be a cleft in that area. The most common congenital defect involving the face and jaws are clefting of the lip and palate. Okay, clefting of the lip occurs, as we said, because there's a failure of fusion between the medial and lateral nasal processes and the maxillary prominence. Okay, and this usually happens during the 6th week. The palatal shelves elevation and fusion occurs 2 weeks later. So if the interference or the problem that happened during the lip fusion was still present during palatal shelves elevation, then that patient is not only going to have cleft lips, but also they're going to have a cleft palate. About 60% of individuals with a cleft lip, they also have a cleft palate. Now, since the fusion of the processes that form the primary palate, they create not only the lip, but the area of the alveolar ridge containing the central and lateral incisors. It is likely that a notch in the alveolar process will accompany a cleft lip, okay, even if there is no clefting of the secondary palate. An isolated cleft of the secondary palate is the result of a problem that arose after lip closure was done and completed. Incomplete fusion of the secondary palate, which produces a notch in its posterior extent, is something that happens. Even أحيانا it's a vivid uvula. This indicates a very late appearance of the interference with fusion. This is a picture of a unilateral cleft lip, and this is a picture of a bilateral cleft lip and palate. So probably this interference started when the lip was fusing and remained until the palatal shelves also failed to elevate and fuse. Of course, you will have later on, probably on your 5th year, an entire lecture about cleft lip and palate and other syndromes of the face. For now, I will leave you with these two tables just to revise what we have studied in this lecture. The frontonasal process, حكينا بتعطينا medial and lateral nasal processes, and you can see the contributions of these processes to the face. بينما the first pharyngeal arch divides into the maxillary process and the mandibular process, and you can see what structures each of these processes contributes to. This is the same table that was at the beginning of the lecture, but you can see here the 5 different stages of the craniofacial development, and you can see any problem that arises during these days or these weeks. You can see the syndromes that are associated with it. As we said, the most common one is the cleft lip and palate. So now we conclude our lecture of craniofacial growth part 1. Thank you for listening. I will add 2 links to 2 videos from a website called Osmosis. You have to create an account on this website for you to watch the videos, but it's for free. I really encourage you to do that. يعني الفيديوز هدول حلو شرحهم مبسطين ملونين فبيسهلوا عليكم شوي تتخيلوا الامبريو بهاي الفترة. I will also add some textbooks for you to read from. هلا في textbooks بتتعمق أكتر من غيرها طبعا. You don't have to understand a lot of details or intricate details. I just want you to understand what we have explained in this lecture. You don't have to memorize the tables, but you have to memorize the most important things like the first pharyngeal arch, what does it give rise to, when a problem happens, you have to understand how it happens, why did it happen, at which week did it happen. Okay, if you have any questions for me, feel free please to send them لمنسق الدفعة or for me personally on my email. I wish you best of luck and I hope this lecture is gonna be easy for you.